Good afternoon, everyone, and welcome to another Nursing Week webinar. Today's webinar is Diabetes Medication and Education, and it's presented by Katie Clarke. My name is Diana. I'm the Administrative Assistant here at ANVLPN. Okay, so before we get started, it is Nursing Week, so we would like to take a moment to wish all of our members and all nursing professionals a happy Nursing Week. Your dedication to the work you do each day is so important and very much appreciated in our communities and by all New Brunswickers, and always be proud of the work that you do. Okay, so a little bit about Katie. So Katie first completed a double major in psychology at UNB St. John before enrolling and graduating on the Dean's List in the Accelerated Bachelor of Science in Nursing program at UPEI. She's worked on an orthopedic surgical unit and in a physician's office prior to finding her passion for diabetes education. She has become a certified diabetes educator as well as a podiatry assistant, both of which she uses in her work at the Diabetes Education Clinic in Fredericton. So just a brief write-up of today's content. So diabetes is a complex multifactorial chronic illness that requires individualized care plans for successful management. One goal of care is to provide self-management strategies for patients. There are many diabetes medications, and with each type comes the need for assessment and patient education to manage these medications effectively. So Katie will provide an overview of diabetes medications, the old ones and new ones. And she also discusses some important items to assess and educate and educational tips that you can provide your patients and clients.
Hi, everyone. Thanks for tuning in today. My name's Katie, and I'm an RN and certified diabetes educator at the Diabetes Education Clinic here in Fredericton, where we educate newly diagnosed and long-standing diabetes. We foster independence and self-management skills, and we advocate for and make recommendations to other healthcare providers with their patients who are living with diabetes. I was asked to speak today on a diabetes-related topic and thought I would take the time today to share with you a bit about diabetes medications and how they work. I'll provide some key things to assess depending on what medication your patient is on, and maybe a few educational tips that you can share with your patients. So why do we treat? Diabetes is a complex chronic illness and requires optimal control in order to avoid micro and macrovascular issues. Though these complications may take years to develop, early detection, treatment, and management is vital in prevention of complications. For years, there were a very limited number of pharmacotherapy treatments like metformin and insulin. However, in the last few recent years, many new effective medications have become available to treat diabetes. So often the first line of therapy for diabetes management is lifestyle intervention. Proper diet and adequate exercise can greatly improve glycemic control. Things such as eating regular spaced meals, limiting sugars, sweets, and high-fat foods, eating more high-fiber foods, and limiting alcohol, consuming more vegetables, and choosing lean proteins more often, incorporating aerobic exercise and resistance training. So this is just a picture of the Canada Food Guide, a reference I use in my practice when discussing healthy eating and portion control with my patients. There are several classes of diabetes medications, and so on the next few slides, I'm going to take you through those. How do we know which to add? So there's many things to consider when deciding which anti-hyperglycemic to add. I often tell my patients that it's easy to want to compare yourself with someone else that has diabetes, but that no two people with diabetes are exactly the same, and nor should they necessarily be treated in exactly the same way. comorbidities, duration of diabetes, other medications, lifestyle habits, stress, pain, genetics. These are just a few examples of how diabetes may differ and reasons why you might need to make entirely different treatment decisions. And so here you'll see a list of additional considerations. So just a few other things to think about when deciding which diabetes medication should be added next for the patient. So side effects, both positive and negative, like weight gain or loss, for example. Efficacy, how high are the blood sugars and how quickly do we need to improve them? Cost and insurance is a huge deciding factor. Some of these diabetic medications are extremely expensive and many are without drug coverage. So method and ease of use, for example, are they willing to do injections? Duration of diabetes. Some of these medications are more effective at different stages of the disease. And then kidney function, often measured by eGFR, is important to watch as some medications are processed through the kidneys and therefore may not be appropriate for some given kidney function decline. So the first medication here is metformin. It's often the first line of pharmacotherapy in diabetes management for a number of reasons. It's cost-effective, has minimal risk of side effects, and works well for a long period of time. Metformin works by lowering the amount of glucose that your liver releases into the blood and helps make it easier for your body to use insulin. The most common side effects are nausea and diarrhea, and these symptoms can be minimized when taken properly. So twice daily with breakfast and supper, or once daily if it's the metformin extended release. It's important to remind your patients that when they're sick, they should temporarily stop this medication during periods of acute illness. This next slide are the SGLT2 inhibitors. They include Jardiance, Forxiga, and Invokana. So these work by reducing glucose levels in your body by increasing the amount of sugar you excrete in your urine. Added perks to these medications is that they can help with weight loss and protect your heart and your kidneys. The most common side effect is urinary tract infection, so it's important to monitor your patients for signs and symptoms of that. Obviously, blood sugars ideally improve, and if your patient is on insulin, it's important to watch for the need to titrate insulin down, as often we see a decrease in requirements. These medications can also affect volume load, so monitoring blood pressure for the need to adjust those medications is also important. Very, very important to temporarily hold these medications during illness when eating and drinking are altered and with vomiting and diarrhea. So temporarily stop these medications, and then when the patient is able to eat and drink again, they can resume this medication. The GLP-1 receptor agonist. So these are often injectables, either given daily or once weekly, like Ozempic, Victoza, and Trulicity. And fairly new is in pill form, known as Rybelsus. So these act when blood sugars are higher than normal, increase insulin levels to help lower blood glucose or blood sugars, and decrease glucagon, which is a hormone that raises blood sugars. These also slow the emptying of the stomach. So the idea is that you feel fuller sooner and consume smaller, more frequent meals. The most common side effects with these medications are nausea and vomiting. Most people who experience these symptoms but say they are tolerable will notice these symptoms to go away with time. Tips to manage those symptoms include smaller, more frequent meals, staying hydrated, and avoiding high-fat foods. Some people will experience weight loss, and those on insulin will likely need to insulin reduce. If it's the once weekly dosing, missed doses can be taken for up to 5 days, as long as 2 days separate that dose and the next dose. So the DPP-4 inhibitors, these are medications such as Januvia, Tradjenta, and Onglyza, and they act when the sugars increase after a meal by increasing insulin levels to help lower blood sugars and decrease glucagon. They work very similar to the GLP-1s mentioned on the last slide, and therefore should not be taken when someone is also on a GLP-1. These medications tend to be weight neutral, which differs from the GLP-1, does not tend to cause low blood sugars, and are overall relatively safe. Sulfonyureas, things like glycoside, glimepiride, and glyburide, help the pancreas to make more insulin. Therefore, these ones do have the risk of causing hypoglycemia. It's important to assess for frequency of lows and educate on the proper treatment, which we will quickly review on an upcoming slide. If they are in fact having frequent lows, this is the medication that should be adjusted. So insulin, there are many different types of insulin: long, intermediate, fast, or rapid acting. Many people feel when they end up on insulin that it's the last resort or that they've done something wrong. Educating on the types of diabetes and the progression of the disease helps people understand that they may be required to give insulin as their body just isn't producing enough or using their own insulin properly. And it's an important key to compliance. Assessing where they give insulin injections is essential, which I'll show on the next slide. All too often, I discover people are giving their insulin either in the wrong sites, which can affect the absorption and time action of the insulin. Assessing frequency of hypoglycemia and educating on proper treatment of lows is important, and we'll go over that in a couple of slides. Discussing with your patient the things that affect blood sugars like illness, heat, activity, food, and stress, for example, and how insulin adjustments may be required at different times. So injection sites. Here you'll see the appropriate injection sites for both insulin and the injectable GLP-1s. The back of the arms is an appropriate site when the injection is given by someone else, such as the healthcare provider like you all. I tell patients they really shouldn't use this site on themselves as it's hard to actually get to the proper site on the back of the arm. Injections can go in the legs, but they must be the outer aspect of the thigh. The abdomen is the best place for injections with the most consistent rate of absorption. So I always highlight this site, explaining that it should be below the ribs and remain 2 inches away from the belly button. And I always emphasize that you need to rotate sites and not to use the same favorite spot over and over, as the area becomes hard and insulin won't work the way that it should. So often when blood sugars are suddenly high or unexplainably up and down, injection sites can often be to blame. I can't stress enough how important it is to assess those injection sites. You guys spend more time with the patient than their primary healthcare provider or any specialist, so it's really vital that you routinely assess these practices. So now I'm not going to be able to say that word. So this can be the result of injection site overuse. Hard lumps and bumps or bruises of fat tissue build up, and it does not allow for the insulin to be absorbed at the same rate every time. This increases the risk for hypoglycemia or erratic, unexplained blood sugars. So using new sites and avoiding these will allow them to improve over time. So hypoglycemia treatment. Sure, most of you are well aware of how to treat, but it's very important to know what to do in case these low blood sugars happen. So for someone with diabetes, a blood sugar of less than 4 millimoles per liter is considered low. When they're experiencing a low, symptoms may include sweatiness, dizzy, shaky, feeling hungry or nervous, being irritable. And I tell people when you're feeling off, you should check your blood sugar to see if it's that or if there's something else going on. This should be treated with 15 grams of fast-acting sugar, so like 3/4 cup of regular juice or pop, 3 teaspoons of sugar, honey, or jam, or 4 Dex-4 tablets that can be purchased over the counter at the pharmacy. And these are fast-acting dissolvable tabs. Sometimes patients will ask if something like a chocolate bar will work, and I explain if that's all they have, by all means consume it. But one of the above things will work faster because something high in fat like a chocolate bar may not raise your blood sugar quickly enough. So you treat that blood sugar, you recheck it in 10 to 15 minutes, and you retreat if it's still low. Once the low is treated, follow it with a carb and protein snack like cheese and crackers or bread with peanut butter so that the blood sugars don't drop again, and to prevent reactive hyperglycemia. that would likely occur if a carb-only snack was consumed to follow. Sick day management. Lastly, I just wanted to quickly mention that a lot of diabetes medications should be temporarily held during times of acute illness when the patient cannot eat or drink as usual and may be experiencing vomiting and diarrhea, putting them at risk for dehydration. Once the patient is back to eating and drinking, they can resume these. So diabetes medications such as the sulfonyureas, metformin, and SGLT2s. Continuing these during those periods of illness can affect the kidneys, so it's really important to hold at times of sickness. So guys, that's all I had prepared for today's chat, just a very brief discussion on diabetes medications with some assessment and educational tips for you and your patients. Things that I hope you'll find helpful in your daily practice. Thank you so much for taking the time to listen in. I hope you found it helpful.
Okay, so that concludes the diabetes education webinar. So just kind of a quick look at medications, old and new. So if you do have any questions, feel free to send them to our practice consultant at npls.ca email address, and we'll make sure that we can answer them for you. The email address can also be found on our website, www.anblpn.ca, under the About tab. So we thank you for joining us today. Hopefully you found this information useful, whether it's just a review for you or whether you learned some new things. Hopefully you'll be able to put it into practice. And so we thank you for joining us today. And once again, we wish you a happy nursing week.